My name's Connie Brayley. I'm a Band 3 physiotherapy assistant.
I'm Chelsea, I'm one of the Band 5 physios at Great Western.
My name's Tom, I'm one of the pharmacists.
My name's Alex Harrington, I'm Head of Podiatry.
My name's Helen Noble and I'm a speech and language therapist.
My name is Anna Knight and I'm an occupational therapist.
I'm Tash, one of the radiographers.
My name's Stacey, I'm one of the senior radiographers.
Hi, I'm Sarah, I'm a senior radiographer.
Hi, so I'm Vicky Bevan. I'm a children's dietitian at the Great Western Hospital, and my role involves seeing children of all ages with all types of medical conditions. There's a whole team of people there to be able to support people with different aspects of the care that they need.
With the ambulance service, it is like being in a family.
Yeah,
and we get any new wounds that are coming through, pressure sores and that, we go out and assess and set everything up with referrals and care plans.
And we also do the triaging, so the urgent calls that come in to the nursing service, we triage those.
In the main X-ray department, we typically X-ray between 200 and 250 patients a day.
We also work with other teams throughout the hospital, so I sometimes primarily work up in the cardiac cath lab and work with a great team up there, and then come down into department and work with other teams like orthopaedics and A&E.
So we have an integrated diabetic foot care pathway here within Swindon. So I have clinicians that work both within the community setting and within the hospital setting to manage people with diabetes who have really acute diabetic foot problems. Teamworking is integral to delivering the optimum patient care, so a patient just doesn't come to see us and no one else.
We're constantly, as pharmacy staff, interacting with doctors on the ward, for example, if we need to change a prescription for any reason because it's unsafe or not optimal, with nursing staff, with speech and language therapists, occasionally physiotherapists, specialist nurses.
We are seeing people with communication problems and also patients with swallowing difficulties, and often people that have an element of both. So we work as a team of speech and language therapists here, but we work a lot with the other professionals.
We don't work in isolation, we work really closely with our colleagues in diabetes medicine, with the vascular teams, with the orthopaedic teams, with the orthotists. And then sadly when things have gone through that perhaps people need to have amputation, and sometimes actually that's a good result for some people. We work closely then with physiotherapists, with rehab and rehabilitation.
We are acute physiotherapists, so we get the patient to a safe level to get them home.
So I'd kind of say that we work together a lot of the time, especially in the inpatient wards, and we've all kind of got our own specific area. So for example, as physios, ours would be mobility.
I love being an occupational therapist. When you come across a challenge, it taps into the problem-solving skills that you need as an occupational therapist to figure out who to work with and which team to liaise with in order to overcome difficulty that patient might be having to achieve what they want to achieve independence.
So it's really about having that holistic approach to someone's care, and I think allied health professionals are really good at supporting the medical staff with that.
Everybody's working towards the same end. Everybody's, it's about their health and well-being and quality of life, but everybody's kind of looking at a slightly different aspect of that, but it's all really key.
You have to be very good at communicating within the team and receiving that information and using it yourself, and then also feeding back to the team. So having daily board rounds with your various wards have been essential for working as a team.
We're constantly using other resources from other areas of expertise within the trust, so yes, it's something we're very aware of and couldn't exist without.
I think the other nice thing about working in a team is that you gain so much knowledge and skills and information from the people that you're working with, which makes you think differently about how you're providing the care to that person.
I'm still learning all the time. You never feel like you kind of can just come in and do your job and you know it all. You're always challenging yourself, and that's great.
Podiatry is completely different from when I started. It's a service and a profession that has grown and developed and evolved in those last 30 years.
We've had to go from our paramedic stuff into the nursing role, which is nothing like what we did before.
Everything we're doing now is a new skill bolted on, isn't it, to what we did as a paramedic? Yeah.
We've got paramedics in doctor's surgeries now.
Yeah.
We've got them in the urgent care centre you know, they work in minors in A&E.
So the role's just developed, hasn't it?
And now they've just got prescribing courses for paramedics as well.
I think the traditional impression of a community pharmacist perhaps would be that the pharmacist would be in a lab coat behind the desk, and the counter staff would be at the front, being the ones who are actually dealing with the patients. We're getting away from that completely. It's not the same as it was. So it's very much the case that we're talking to patients all the time.
If you don't know exactly what we do, then you might be surprised how involved we actually are in a patient's journey. We have quite an impact.
We get involved quite a lot with family, so it's quite nice that they do recognise it.
I must admit, all the patients we had were really nice, weren't they? And we managed to solve the problems. It's when you can't solve the problems.
Frustrating,
I've been out and done a catheter just now, a male catheter, you know, and he felt so much more comfortable. The catheter is now draining. We've checked all his skin, everything. He said, "Am I all right?" I said, "Yeah, you're fine."
The main way I would say it's rewarding is when everything comes together to provide a really good outcome for the patient.
And when they first come in, they look so anxious and scared, and then once you get working with them and get them up on their feet, to see their progress is really rewarding. And I had a guy the other day and he stood up and he was like, "I just can't believe I've stood up."
My most rewarding bit, I would say, is working with the patients that come around from A&E who have got quite acute or quite kind of bad fractures that we need to manage and deal with, and making them feel safe in quite a vulnerable situation.
If they've never had scans before, just being able to comfort and help them through something that we do every day, but something that they may not be necessarily used to. So I find that quite rewarding.
It's just the small ways that people show their appreciation, you know, taking your hand and squeezing your hand and saying, "Oh, don't go," and, you know, just small things like that.
Well, it's really nice when you maybe get a card through the post to say thank you. And as much as it's lovely to build relationships long term with families, sometimes it's also really nice to be able to, when they come to the end of their treatment, because the condition has resolved, that they don't need you anymore, or they have the skills and the knowledge and things to be able to take that forward. And that's really rewarding as well, so helping them feel that they're the experts in managing that condition.